Hi, this is Marcy White at Copley Acupuncture, and I just wanted to talk today about knee pain. I have a wonderful treatment that I use in my practice for knee problems that are the result of post-op surgery complications or some type of trauma to the tissue. So this is not a treatment that I do if there are knee problems due to issues with the feet and ankles or higher up with the hips or the low back. If that's the case, then those areas need to be addressed, and the knee problem is just kind of the secondary issue. But if there's been some type of trauma from skiing, overuse syndromes from running, or post-op surgery problems, then this treatment is wonderful. So it uses electroacupuncture, and what we do is we treat the knee in multiple areas. I'm going to show you a video in a moment of the treatment, and it aims to increase blood flow into the tissue, reduce inflammation, and also we can help with the repair of the tissue. So there's a number of ways that this can happen. I use low-level laser, as you may know from some previous videos, and the low-level laser can get to deeper structures in the body that needles sometimes can't access. So I like to do a combination of the acupuncture with the low-level laser. So we can get to deeper scar tissue. We can get into bone, for instance. So acupuncture can also address those things, but sometimes, in my opinion, it doesn't get quite as far as we need it to. So I'm going to show you a video of how this works. And if you have any type of knee trauma or knee pain, or you've had knee replacement and it's been a long time since the replacement and you're still not where you want to be, this is something that you might want to consider. Thank you so much. Okay, so we're ready to go with the treatment for the knee. And again, this is a treatment that you can do for basically any type of knee problem because it really covers a lot of ground. So what I've done is I've needled a point above the knee and connected it, you can see with the blue wire, to this point below the knee. Then there are two that are under the kneecap. These are called the eyes of the knee. There's little indentations, little grooves there. Those two are connected to one another. And then we've got one from here to here. And so what it does is it allows the current to go from back and forth. It's calibrated from spot to spot. So we're covering the entire top of the knee with the blue cords. We're getting under the kneecap and the patella and around the patellar ligament with the ones under the knee. And then this is following a whole line up through the medial knee. So what we do is turn them up. This is again, the Pantheon electroacupuncture device, which I absolutely love. It's very versatile. And what we're gonna do are these lower channels, which are called the microhertz frequencies or microamps. The upper channels are milliamps. And so basically what you do is you put it on the frequency that you're gonna be using. For our treatment, we use 25 microhertz and turn the machine on. Make sure everything is turned off here. And these controls are for each one of these channels. So first we would start with the blue channel and slowly start to turn it up little by little. And what I have people do is tell me when they start to feel it. So either you'll feel it here or here. And you feel kind of like a little tapping or a pulsing, depending which frequency is being used. We're using 25 hertz. It makes it faster or slower. So if we go down to a lower frequency, it's going to get slower. But for our purposes, we want to do the 25 hertz. This helps with repairing tissue and reducing inflammation. And you basically turn it up little by little until the person starts to report that they're feeling it. And again, it feels just kind of like a pulse or a tapping that matches the beat of that green light. And so typically when you get to about a 3 or a 4, I'm starting to feel that now. I'm starting to feel little tapping, little pulsing going on here. And then you want to turn up the next one and the next one. And you run this for about 20 to 25 minutes. And the number of treatments that you need depends on the type of problem that you're having. So, I typically recommend coming once a week for the first kind of round of treatments, and we see how the person's feeling. So after we've removed the electrodes and taken everything out, then what I will sometimes use is my Luminex laser. And so it depends on what the problem is. This knee did not have a knee replacement. So sometimes there's scar tissue. We would want to follow along where the scars are, and then you can use the light on that. Again, we use different frequencies depending on what the problem is. So when this laser is turned on, you'll see the startup screen happening here. And then depending on what kind of issues you're having, we'll use different settings. So 0 PPS means 0 pulses per second. What that's called is continuous wave laser. And so when you do continuous wave on tissue, it has a number of different effects. It can increase blood flow in the tissue. It can help with really tight motor muscles. And then we would want to adapt this to whatever kind of issue is going on. So 2 pulses per second, 5 pulses per second help with nerve issues. I typically will go to 73 pulses per second to start, and that helps with pain. And then we can go up to 2,000 pulses per second, which is an anti-inflammatory setting, and then finish off with a setting somewhere in the middle. I might do 146 or 292 pulses per second, which helps with scar tissue.